He has an Opus card and a microphone. You're in transit with Elias Mackos, CJAD 800.
All right, on In Transit today, let's take a look at this story. In Montreal's East End, some healthcare workers are ditching their cars and boarding city buses to reach patients. That's thanks to a cost-cutting move that slashed vehicle compensation. The change affects over 350 employees, forcing them into commutes that can take up to 3 hours and drastically reducing the number of patients they can see in a day. Workers say it's a major blow to both efficiency and access to care, while the Regional Health Authority says it's going to save $200,000. Let's go to Sonia Barreau, VP of the union representing the workers affected by this. Sonia, welcome to the program.
Hi.
So, Health Authority says it's going to save $200,000 a year. That's the savings. Why don't you tell me what this will cost?
Well, it will cost for the patient because they will be waiting more time to get their care at home because the professional won't be able to see as many patients a week as they usually do when they use their car because of the delay of the buses and everything that goes with it. So it's going to cost health for the east of Montreal, and it's a hazard for the health of our workers because taking the buses is long. Now it's sunny and funny to take the bus maybe, but during the winter, you can fall with on ice and everything. So there's no really efficiency there.
What kind of care are we talking about here? What kind of home care visits are we talking about?
We're talking for physical therapists, occupational therapists, nutritionists. So it's the way to take people out of the hospital into their home. It's with those kind of care, and we have to go fast, put people out of the hospital into their home or maintaining them at home, and everything will be delayed. So you'll see it's going to be traffic somewhere.
Why don't you give me some examples here? Because I'm trying to think about the daily life of someone who works, going from home to do these occupational workplace related incidents, or you're talking about physiotherapy. Tell me about a typical day with a car and how it's changed now that they're not taking their cars.
Well, if you're taking your own car, you make your route. So you're going to say, I'm going to see patient A at 9 o'clock, patient B at maybe 10:30, 11, and so on. So maybe you'll be seeing four people, four patients for a day because you have to make your files and everything. But if I take my car, the bus, then I have to wait the bus if the bus is on time. And then it's around double to 3 times the time to just take my car from point A to point B. So mathematically, I won't see 4 patients. So I will put patient C and D for the next day and so on and so on. So people won't have as much care as they are supposed to be, or they will be waiting on the waiting list longer. So they will be weaker, or their readaptation will be slower.
So can I ask you if maybe this should have been done on more of a case-by-case basis? Because I have a note from a listener that said they work in home care and that, they've done it before with a car or sometimes bus, metro, and they said, it depends on the schedule and depends where the clients are, right?
Of course, but forget about metro. Yeah. This is the east of Montreal.
Yeah.
It's the worst part of the
That's
town.
True. That's true.
If you're in the heart of Saint Leonard, you have to take 2 buses. I have one. Just to see one patient, it's 45 minutes bus, 15 minutes walk. One patient.
Yeah.
So it's mathematically, it's not good for the patient, and the money they will save is so little. But that's their choice.
How much was the government reimbursing for personal car usage?
It's still reimbursed. So
Okay.
if we still take our car, it's still the kilometrage is 63 cents So that's the same. But if I don't, the rest, it's the insurance because you have to take a special insurance, affaires, business, because you're working with your car.
Yes.
So the difference is paid. The parking is paid, and there's a little amount of money to compensate. It's 0 cent, so $0.08 for the compensation of the use of your car, because you're going to be using, making your car older faster, if you see what I mean.
Yes, of course. Yeah, the wear and tear on the vehicle. So wait,
exactly. Thank you.
So the government is still paying for the kilometer. So wait, what's changing here? What are they no longer paying?
They're not paying the parking. They're no longer paying the insurance, and they're no longer paying the little the 8 cents kilometers for the overuse.
Do you think a lot of employees will just say, okay, fine, I'm just going to keep taking my car anyways?
Yes, some of them will, because they're not in good health. It's energy cost to take the bus, to wait for the bus, to walk 15, 20 minutes. Some of them are not that in good shape.
Yeah.
But we hear that many are not taking their car anymore, and it's making a headache.
And one last thing, I imagine you have a lot of equipment too, right? People who work in healthcare,
exactly.
And what they want you to just bring it on the bus and like.
Well, they're trying, but the people are strong and they say no. So we have to send it through a company, so André Vigé company or something like that, and it's $50 each time we send materials. So machette, can, crutches, bomb, for the bathroom, anything. $50 every time. So you send it, and then you go, you evaluate. It's not a good thing, so you have to bring it back. So another $50, and then you go on.
Do you think at the end of the day the government's actually going to spend the $200,000 they say they're going to save? Do you think that that's actually what's going to happen?
The l'Est de l'île de Montréal will probably, at the end, maybe a little bit of some saving, but not that much.
Yeah. Not worth it at the end of the day for the reduction of cost of care.
Not worth it at all for the patient, and not worth it at all for the workers. That's for sure.
Sonia, I have to leave it there. I want to thank you for coming on this morning.
Thank you. Have a good day. Bye-bye.
That's Sonia Bureau. She's VP of the union that represents these healthcare workers affected by this change.